Thank you, sir. First of all, thank you very much, sir, for giving me this opportunity. And I thank all the IMA Bhubaneswar members for giving me this opportunity and be here to listen to me. I don't normally talk about traditional medical subjects nowadays. So I am now thinking of how, like, it's my 35 years in this medical profession. So I thought in the 35 years I have passed through many ups and downs, like every one of us. But I've seen that almost everyone they don't discuss this thing. We discuss with patient, we discuss with patient relative, we discuss with our friends, discuss with. So we have a talk, doctor to rest of the people, then doctor to doctor. You all agree, we never share our pain and agony very seriously with anyone. We can have we always talk, but not very seriously. Everybody wants that these are bad things. But I thought only talking that this is not good, this is not bad, there is not bringing any solution. So can we bring some solution to that? And it needs time. And it is a need of the hour that we people who are now going towards like I'm 59. So I think I'm also thinking how rest of my life I will be utilize my knowledge, because skill is something we have given for so many years. We all have shared our skill, we have served with our skill, but the knowledge has gained by, I think, 100, 1,000 folds in this last so many years. So I thought, can I share my knowledge? Can I share my knowledge? And I found where to share my knowledge. So I found that there is no platform. Everybody is telling me to talk about a subject like gallbladder, spleen, appendix, where thousands of things are telling. And our students and everybody has got, in this Google Edge, everybody has got a mobile phone and they are getting the information what we wanted to tell them. But the things which is inside our heart, it is never being shared. Nobody is asking us how much painful journey we had, how much difficulty we had to treat a patient, how much sacrifice we have done. Everything, everybody has sacrificed their family, their time, their money. Name a thing we have sacrificed, but we do not get any recognition. So I thought, why not to make a platform for that? If it is not there, why can't we build a platform? And since last 10 years, I've been trying to build this platform, and ultimately we made a platform called Global Self-Healthcare Education and Research. And now I am coming to doctors also. And thank you, sir, for giving me that opportunity. And today this is the introductory class session, I can say, because it will go on continuing. And it is not me only in this platform. What we are going to do, that we are going to discuss today. And I want that everybody should participate in this program. So I named the program Dr. Biswajit Speaks. So it is not I will speak, but I will make you people also speak. Fine. So it is not typical lecture which I'm going to give you today. Here today we are going to, this will be a platform where we'll go to have a reflections. We'll share our reflections. That is very important. This particular word, remember, reflections, what we think about the world, about the colleagues, about the hospitals, about the present medical system, about the things going on, about the future generation of doctors. There's so many things you have to discuss, because yes, today I am telling you Man Ki Baat, and because I know that alone it is not possible. I need people like you. I need so many senior people. I need the people who can spare some time. I need people who have lot of things to say, lots and lots of millions of. If everybody will start telling a story, it will take every day, 365 days, 10 years will go with everybody speaking one story. Fine. So it is a platform where we are going to speak, we are going to listen, we are going to reflect, we are going to agree, we are going to disagree also. We may be having a lot of points where we will be disagreeing also. It's good. Disagreeing and this conflict also is good. We will be doing in this platform, and we'll confess also. Let a lot of people, a lot of things, like I have a lot of things to confess. Like we have done mistakes, because this is a platform for doctors. We have done mistakes, we have learned from our mistakes. There's nothing wrong in it. So because the moment we confess our mistakes, our next generation, the people, the younger people, the younger generation who will be listening to this, they will be brave enough. They will think a mistake is a sin. But in our profession, mistake is not a sin. Mistake is experience. We all have done. You agree? On the person who doesn't say, I have not done a mistake, I don't think he has done a good medical practice. So we all have done mistakes. So if we share our mistakes also, then it is going to change. The future generation is going to listen, yes, our senior have done the mistakes, so we have done a mistake, so we'll correct it. Because if you accept mistake, you will have a chance to correct it. I always say, we do not know what we do not know. It's very dangerous. It is very dangerous. It is not dangerous that we do not know, but it is very dangerous that we do not know what we do not know. So here, this platform will be speaking about what we do not know. We'll have to reflect. So this is where we are going to speak about the unspoken pain points. There are a lot of unspoken pain points we have never discussed with anybody, but we will be discussing here. Will we offer practical solution to the problems? We can discuss of the problem, and you can, once we agree that this can be a solution, and we may forward it to people, forward it to our platform. This is a solution. Everybody think, can you use it? Can you try this? This is you can do, and we can we can start thinking beyond the prescription. Like this center where I'm sitting today, when you are this is my conference hall, and this is where this name is New Prescription Point. So here we change the perception of people with the prescription. They come with a prescription to me here. I look into that prescription, I go through them, and I try to talk to them about. So here they change the perception towards their own body and mind. And you will not believe, I'm getting lot young people, 35, 40, 25 years from school children are coming here. And when I talk to them, I find that there are a lot of, scope, and they are so happy, their parents are so happy, because I'm giving them 1 hour time. And nothing is free. I'm not telling I'm doing a charity. I'm doing a thing which is a part of my curriculum. As a doctor, I have a lot of knowledge about your body and mind, and we are the best counselors. I believe the doctors are the best counselors. So I'm using that particular thing which is there inside us, because I don't think anybody is a better counselor than a doctor, because we know about the body, we know about the mind, we know about the physiology, we know about the biochemistry, we know about the disease, and we have a solution to everything. Only thing is that we have to give time, and that is a scarcity. I think we all can give time, and it is not free. We can earn 3 times. I always say you can earn 3 to 4 times. I charge 3 times sitting here for 1 hour. No, people give me. They give me they give me money with the respect also. The things that we are charging very little, because now they are very happy. So here we are going to discuss that. And I always say, there is a word, last time also I uttered, that we are serving with our skill in the hospitals and the clinics, but we should earn from our knowledge. This is a tagline. We should earn from our knowledge. And when we start earning from our knowledge, I think that day is the best day for us, because we will be doing it very happily, and there is no tension in sharing a knowledge. Because the moment we share our knowledge goes on increasing. Like I'm sharing with you something today, and I'm increasing my speaking ability, my stage presentation, my everything. I'm improving. Today at the end of the show, I'll be more improved than before. That is what my aim is. And and here we have to say that there is one line I will say, that is called patient-centric and doctor-friendly atmosphere. Doctor-friendly atmosphere is very less nowadays. Even in the hospitals, if you see, in the hospitals, it is not doctor-friendly. Even our colleagues are not behaving with us properly. They are hiding from us. They feel that we are their competitors. So a doctor-friendly atmosphere is very much needed. And what this Akashbani, Bhubaneswar Akashbani is doing, I think it is a step Sir has already taken. I want to now give it a wing, so that we can fly more. We can fly more. We can bring such a beautiful community, which we are already beautiful. We are very good people. Doctors are the best people, I always say. And I don't think we have any competitors. I have not yet found any competitor with me, though there are 28 surgeons in the city. I have never I think anybody has had competed with me ever. Even I teach school children, that is called Race Against. I have written a book also, it's coming up very fast. It is called Race Against Yourself. I compete with myself every day. Every day I compete with myself. I feel that the more I compete with myself, the more better I will become. But the moment I compete with my colleagues, the moment I compete with my other doctors, then I will be going down and down. And it's happening. The more stress and everything is coming from there only. And I think, I have a very important thing to share today, which I have delivered to my postgraduate students also, that how our future doctors should be. How should we be? So I have three eyes for my future doctors. I call them, the future doctors should be inspirers. That should be inspired. They should inspire the patient, they should inspire their colleagues, they should inspire the public also. They should be innovators. Innovators means because we are innovators. We are innovators because we work in the most adverse condition by innovating ways. We don't practice. Every doctor, every surgeon, they have practiced in a condition which is not written in our books. We are already innovators, but we have to express ourselves as innovators. We should be integrators. The three I's. We should be inspirers, we should be integrators, and innovators, and last one is integrators. We have to integrate so many things, because when we are talking about disease, we are treating as about textbooks, as about protocol we are teaching. But with that, we integrate the health, because we are not integrating health there. All of our attention goes to treating the disease. And after the patient, and we treat the disease, patient goes home, he forgets us, or he comes when again he has a disease. So I have made it a point that I will integrate all the health, because it took me a long time to learn about health. In 2011, when I had a problem, when I was looking that I should be out of the drug, and I was thinking what to do. So I took help of so many people, but I found that the health segment is totally unexplored by doctors, and it has been taken care of by people who are not at all health illiterate, and misinformation is very high, and they are fragmented. So in last 10 years, what I did, I started doing a integration of knowledge. So once we integrate those knowledge, health knowledge with our disease, I think we are the complete doctors. We are going to be complete doctor, and we will be doing the best for the person, and also we'll do justice to ourselves. Today we'll have the introductory presentation for doctors, and this will continue every week, every Thursday, a weekly 30 minutes platform for doctors to speak, reflect, share, and redefine the future of healthcare. So today's theme is time to rethink the medical profession and redefine the healthcare industry. Remember one thing, healthcare industry, what we call this now to the healthcare industry, it is no more a doctor's domain now. It has gone out of our hand, unfortunately, because we never took any action to stop it. It has gone because we are now 10%, not 10%, less than 10% of the healthcare industry. It is very painful to know that we are the front bench, the soap men of the industry, but the control is not with us. Because in the hospital, if there are 100 employees, 10 people are doctors and 90 are non-medicals. So that's why the ratio is changing. So somewhere, can we do something? Can we take some action in future, slowly, so that again this profession will come back to us? That's my question. That's a pain point. I feel it's painful that when somebody talk to me about instructing me to treat a patient with the things they want to do, it's very painful. I have never seen, because 10, 12 years back, it was not there. I think when you people were doing, that was not there. But in the last 10 to 15 years, everything has changed. And we are now reduced to 10%. So here, can we do something to redefine the healthcare industry? So how can you do it? So it's a question we'll be discussing with that again and again in this platform. So now question is, why this type of things now I am coming up? It is not now. I've been thinking since last so many years, but I never had a platform. So after I made the platform, since last 3 years, I've been researching on all the things, all the avenue. I've been meeting people. I've been doing my homework. How can we redefine? So I realized one thing, that now the healthcare industry is very stubborn. It is growing. It has grown to its height. It has gone to its height so high that it will not bend to anybody, not to even doctors. They can use us, but they will never bend. Now, when we can take care of the health, our knowledge, if we use, and we can build a health industries with simultaneously, if we take control of the health industry, which is more powerful and more bigger than the healthcare industry, then there will be a parallel. When the people start asking for the health doctor, they will come to us for health, and we will be the person sharing our knowledge. We do not have control of anybody. That is maybe a time when it comes, when we will again be equal to the disease care industry. So that is where we have to take part in this part, because we have neglected this part because we are so busy in treating diseases, we have neglected the health part. So I have created step-by-step formulas and everything, gathered, integrated the knowledge from starting with physiology, biochemistry, and you talk of anatomy to public speaking to everything, and to digital. Even digital marketing is a part of healthcare industry now. So all these things I have created. So doctors are, I would say, we are clinicians. We are emotional, legal, social, and economic burdens that rarely get a safe platform. There is no platform. IMA is a platform. We are talking about a disease doctors platform, but we never discuss all the things which I'm talking about. We never discuss about emotional burden which you have. We never discuss about social thing. We never discuss our economic burden. We never discuss all these things in IMA platform. So I was looking for a platform. So I have created a platform where you can discuss everything you want to discuss. We can choose up. That's why I'm slow. That's why I'm coming now, because I have started built up a system. Because without system, nothing will work. Without system, nothing will work, because we are having this burden. So we have to discuss out initially within us, then we can strengthen the system. So we'll discuss. I will come to that. In this every Thursday we'll be discussing something like that. So we doctors listen to patients every day, but who listens to doctors? This is a very you can ask yourself, who listen to us? Nobody, neither the hospital, neither outside, nobody listened to us. So our expectations have changed faster than professional support. Fine. Medicine is increasingly defensive, transactional, and emotionally costly. The people say young doctors need direction. There is no one to give direction to the young doctors. And I think this is the role which you have to play. The senior doctors, they carry the unspoken wisdom. We have the wisdom, but we are not speaking up. The wisdom which we have, we are not speaking up. Why can't we? Who stopped us? Because we are busy? That is one thing. We all are busy. But we have a responsibility to the next generation. So here it comes the importance of this type of programs. A collective voice can transform fear into clarity and silence into leadership. So we need more health leaders. We don't need management people. We need leaders among us who will lead a group of people, where millions of doctors to one stage, not these media political leaders. We need people. So we have to build up. Somewhere we have to prepare ourselves as leader. And leadership is a quality, it is a learnable thing. It is not that it is not learnable. Not that Modi ji has become a leader in one day. He has learned step by step everything. He has applied the process. So I have when I go and speak about leadership in the corporate world, I have a program called Cellular Leadership Protocol. So everything has got a cellular success protocol I made for the people who are competitive exams for UPSC. Because cellular is a protocol, it's a technique, it is a tantra, nothing more than that. And when you have a protocol, you will be successful, the chances is very high. So we will be doing it gradually. We'll know, and I will come to that later on. So what these programs on every Thursday we will be doing, it is a dignified platform for professionals' reflection and collective problem solving. So we'll be discussing on this one. And so here we'll speak about, let doctors express what is usually hidden behind duty, discipline, and silence. These are the three things which make us silent. You know, duty, oath which you have taken, and another we call it I call it tunnel vision, which is given to us, that doctors will do this only. No, doctors can do so many things. Why only present treatment? We can be good leaders, we can be good speakers, we can be good, and we can do anything because we are the best. So here comes the discipline. We have to, behind duty, discipline, silence, we have to speak up. We don't speak. We always open our mouth very slowly. We don't never, because if you see every profession they shout, but we never shout. We just, because we have a responsibility. So we have to speak. We have to reflect, examine everyday's professional pressure without blaming patients, hospital system. So what I'm doing today is I'm not blaming any system. It will be there. We cannot change them. So what can we do? We can bring the change from ourselves. We can bring the change within, because that is possible. What can I do? How can I serve the community more and more? That is inside me. But I cannot say to change the hospital. I cannot say my hospital to change their behavior. I cannot ask a corporate if they will not put the target. I can say, but I can always refuse. No, I cannot fulfill your target. I am a doctor. I will do the things. But that needs a courage. Fine. And restore the professional confidence, self-care, communication, and emotional balance. We have to heal ourselves. We are all sick people. In the morning, if you go to the hospital, and when you come out from the hospital, you are so much a burden, patient burden, hospital burden, the relatives burden, and the everything, financial burden. In all the burdens, we are so unstable people. And I worked for a hospital for 22 years. And 22 years, I built up the surgical department fully, from one patient to 100-bedded hospital full. And you know what happened? When the management changed, the son came, we have to leave the hospital because we couldn't tolerate that one. And one fine morning, I found the things which I built, so it was an emotional trauma to me. And maybe these are the things which has brought me to this. It's not that I'm incompetent, because I was emotionally unstable. That for some, it was I think for 15 days or 20 days, I was thinking why these things happened to me. I built everything, and now everybody must have faced this. So now it comes. So we have to heal ourselves also somewhere. So we have to take self-care. Our confidence level, though it is in a skill field, our confidence is very high. But when it comes to the other part, we are not that confident. And we have to move doctors from passive survival to ethical influence, and we have to be leaders. So somewhere we all have to build that leadership quality, and it has to be learned. We cannot be leader just like this. Every person has to be a leader. He has to follow certain protocols, and he or she can be a leader. This is not a complaint platform, a thinking platform. Not against anyone, but I always say that it is for the clarity and dignity of the future of the profession. So we will be discussing in this platform all these small things. So there are, as I told you, we'll be discussing about the pain points. There are certain pain points for doctors, and we'll highlight these pain points. This show will take up one real issue at a time and move towards practical solution. Suppose one day we'll talk about burnout and emotional fatigue, our exhaustion, irritability, family sacrifices, loss of joy, and we'll all discuss out how it is possible that our colleagues, what message we are going to send to the things.